Hello, my name is Rami Saleh. I'm a licensed acupuncturist at Healing with Zen in Pasadena, California. Our phone number is 626-377-9596. You can find more of our case studies and learn more about acupuncture at www.healingwithzen.com. Today I want to talk about neck pain, which in technical terms is known as cervicalgia. This ailment may be accompanied by pain radiating down one or both of the arms. Other sensations may also be experienced, such as numbness and tingling. These symptoms generally involve the nerves that branch out of the cervical vertebrae, which may be inflamed and swollen, possibly accompanied by anatomical changes such as herniated disc or stenosis of the spine, which is a narrowing of the space within the spine itself. Today I want to share a case study of a 54-year-old woman who came in to see me for acupuncture. I chose this case for several reasons. 1, it was a difficult and somewhat severe condition. 2, it was a case in which acupuncture really shined as a therapy. I truly respect the power of all modalities of healing, each with their own strength and purpose. However, this patient had undergone physical therapy, massage, chiropractic, etc., but did not find the relief she was looking for. The third reason I chose to share this case is because of the tremendous results over a very short period of time. And the fourth and final reason is because there was a valuable lesson to be learned regarding changes that may occur in the body post-treatment. Now for the case study. This patient had sustained a concussion due to the fact that a large ladder fell over and hit her in the back of the head. This incident occurred in November of 2018, so she has lived with the aftermath and has undergone therapy for over a year. She presented with neck pain that was consistently a 7 out of 10 on the pain scale, shooting pain down her arm, her right arm, and severe numbness of her 3 middle fingers. I treated her with acupuncture over the course of 6 weeks, 1 treatment each week, with a slight hiccup at the beginning, which I'll mention. Usually for a severe condition such as hers, I recommend treatment at least 2 times a week, if not more. In her first visit, which was on 12/19/19, she told me that the worst pain she had at the moment was in her wrist, at a 6 out of 10. She mentioned that she could barely feel her 3 middle fingers. I selected acupuncture meridians that would balance those that run through the wrist as well as the arms and neck. By the end of the treatment, she reported that she had no pain in her neck and wrist. She had some pain left in her arm, but that too was reduced. She also commented that she felt a tingling in her fingers. I assured her that she shouldn't be alarmed because this was a good sign. I asked her to recall that when an arm or leg falls asleep, the first thing we experience is a tingling sensation when the feeling returns. On her second visit, which was 2 weeks later, 2 weeks, on 1/2/20, she explained to me that she wasn't going to come back and see me because after the first treatment, she experienced a terrible headache and earache. It lasted about a day and a half, and she decided to take over-the-counter medication. She said she didn't think that we were still friends. But over the course of the week, she got her bearings and decided to come in for more treatment the following week. The pain had returned and was sitting at a 5 or 6 out of 10. Her wrist, however, had been pain-free. She still had pain in her right arm and pain in the thenar eminence, which is this mound area at the base of the thumb. She still lacked significant sensation in her 3 fingers. At the end of the treatment, the thumb pain was gone and her neck pain was reduced to a 3 out of 10. On her third visit, which was on 1/9/20, the first thing I wanted to know was if we were still friends. She chuckled and said, "Yes, truly we are." She explained that she did have another headache following treatment, but that it was much milder and shorter in duration. She reported that she felt amazing and that her energy was soaring, which everyone noticed at her workplace. She told me that she had been pain-free the entire week and that she could feel her fingers again. She told me that she had no complaints at this time. Of course, I too was thrilled by the fact that she was gushing with so much joy. I continued to treat her over the next 3 weeks to ensure that the results would last and that she did not relapse. At the end of her course of treatment, I'm happy to say that she is still enjoying her newfound state of health. So in closing, I want to mention that it was interesting that she experienced the events she did post-treatment. It was as though there was a blockage of some kind that was released and caused an undesirable experience. Nevertheless, it was utterly necessary that she go through this gate of fire for the healing process to be actualized. I hope that it serves as a means of encouragement for us to persevere through our experiences of change and discomfort, so that we may find solace among the shifting sands. Thank you all for tuning in. Again, my name is Rami Saleh at Healing with Zen. Our phone number is 626-377-9596. You can find more of our case studies and learn about acupuncture at www.healingwithzen.com. See you on the next one.